that's where it should have ended.
Okay.
This isn't working, we're no longer participating.
Can he answer the question so we can learn something instead of listening
Okay.
to you, Ken?
Okay. I really want to get back to healthcare, but I want to look. It's a fair question. So I just want to say this: strip it all away. By subsidizing it the old way, we were not only subsidizing education, we were providing a lot of profit to the banks. Now we should have a discussion about whether you think it's government's job to provide profit to the banks. The implications of what you are saying, and I'm not going to tell you that you're wrong, I'm just going to say you have a different vision of the role of government than I do. The implications of what you are saying are hundreds of thousands of fewer Americans attending college. And to my way of thinking, and look, I'll give you examples of where I've been hardcore fiscally responsible, but to my way of thinking, government helping students to invest in their own education is just about the very best investment that we can make. Let me get a few people who haven't asked a question. Yes, ma'am.
I'm wondering what we can do to prevent seniors from bankrupting themselves once they pass the 100-day mark that Medicare allows, and private insurance companies. We're now paying $72,000 a year for care for my mother.
Yeah.
Because she's no longer covered by Medicare or her private insurance.
Well, yeah.
That's a lot of money.
An awful lot of families go through the spend down until they qualify for Medicaid, and that's a sad thing. You spent your whole life, building up a nest egg, and then at some point in your life, before you move on, you're out of money and you're in the Medicaid system. I know that's really uncomfortable. I'm not sure I know the answer, and I'd be very interested in what you think the answer is. But one of the things that we can do that, look, I think I've been pretty honest about the uncertain nature of the cost savings attempts that are in this reform bill. One of the things that we must do, though, is reduce those costs. They go up 15% every year. And make sure that we're caring for our seniors in the appropriate environment. Seniors would much rather stay at home, and it's a lot cheaper to treat them at home than it is in a nursing home. And yet we have underinvested in the home care. This is a bargain.
That's what the $72,000 is. It is home care.
Yeah.
We moved her out, stopped medication.
Yeah.
It was all ridiculous.
This is, and I would touch again back on the CLASS Act, which is this long-term care insurance, but this is a discussion I hope we can have moving forward, because this reform doesn't fix that problem, and we ought to take that up. Yes, ma'am.
I want to find out, I still don't understand about the having more time with the doctor. I want to find out, what about having your own doctor? When you go to the hospitals now, you can't have your own doctor come into the hospital. In more work for Stanford, you have to have a substitute doctor, whatever doctor is employed by the hospital. Your doctor can't treat you. Why is that? That's just terrible.
And so this is true regardless of what the malady is? They don't let...
As far as I know, cancer is
certain groups of doctors will not go to hospitals. So there's hospitals they have on the table, doctors who are called hospitalists.
Hospitalists, yeah.
Right, and they charge through the nose. Because it happened to me. There's several hospitals.
Yeah. I'm sorry? The question was, why is the system set up so that if you go to a hospital, in some instances the doctor that you've been dealing with cannot treat you in that hospital? And I don't have a terribly good answer for you, other than I know that certain hospitals, certain doctors have privileges at certain hospitals, and some hospitals, some doctors don't. Yeah, no, and Pat is right. They now have this category of doctors called hospitalists, where I know that they try to encourage you to use that in-house doctor. But as you can tell, this is not something I'm expert on, but I will dig into it, because I know that's terribly uncomfortable to all of a sudden be dealing with a new... Yeah. Yeah, that's right. Thank you. Yes, sir. And then I'll come over here.
Earlier you mentioned about a reduction in drugs by 50%, and some drugs that are going to become generic, and it's going to be an influx there. But is it true that it's been mentioned in trying all the falsehoods out there that the drug companies now, their brand will stay for 15 years before they get the opportunity to become generic? Is that true or false?
It is false, except Congress about taking biologic drugs, which are sort of next generation drugs that are created using biological techniques as opposed to chemical techniques, and giving them a little bit more patent protection than has been true in the past. And the logic for that is that the investment that the companies make in these biologic drugs is really huge. It hasn't actually passed the Congress yet, but there is an argument in that regard specifically for biologics. For other drugs where we've always been, which is there's a certain amount of patent protection and then they're subject to generics. It should make you feel good that a lot of drugs in the next couple of years are coming off patent protection and there will be cheaper substitutes. There's a little bit of an unhappy quality to that too, though, which that means that there's been a drop-off in new discoveries, good results from the R&D that the pharmaceutical companies do. So we actually want them to build that pipeline of new discoveries up again, because that's how someday.
Doctors get a kickback from the prescriptions you get billed, so are they asking you once other than the generic, because they're going to get a percentage from the drug companies that those breeds then give them a percentage for the prescription that they ordered?
Not directly, but there has been a lot of talk about the fact that the pharmaceutical companies over time have given doctors vacations and conventions in Las Vegas. They don't. So the answer is not. It's not actually money changing hands. Although a doctor does bill you for prescribing you a drug, there's been a lot of focus on that, though, and I think the pharmaceutical companies have heard pretty loud and clear that in a fiscally tight environment, they've got to lay off that stuff. But that has been a problem in the past, yes. Folks, I'm sorry, I think I've got time maybe for these last two questions, which I'm delighted to take, but then I need to move on. Let me start at the back of the room, ma'am, and then, sir, I'll come right up to you.
The generic drugs that you were speaking about, a lot of them come out of China. How can we change that to make them produce them here in the United States? And also, if you brought the Associated Press, it says that the new Medicare prescription coverage gap will not be fully phased in until 2020, and the coverage gap starts after the $2,830 spent on medication in a year, and then seniors will pay out of their pocket until they spend $4,550.
Yes, so part two of your question was about what I've been calling the donut hole, the coverage gap. And up front I said we start to close it right now with a $250 credit plus that 50% savings on brand to drugs. It doesn't completely go away until 2020. So over each of the next 10 years, the amount that you get rebated will go up until it closes that, is it $4,000 I think, that $4,000 gap?
$50 we'll have to pay out of pocket.
But that begins to close in every year between now and 2020 until 2020 when it is entirely closed. On your generics question, for anybody who didn't hear it, the lady asked, generics are produced, I guess, abroad, China you mentioned. I actually don't know where the bulk of these things are produced, but I take your word for it. This is a whole... Yeah. Now this is a whole other discussion for another town hall about, exports and imports with China and their currency, but yeah, I'd love to see an awful lot more of that done in creating jobs right here. I can take the last question from the gentleman there.
Congressman, I want to thank you for coming here and for this wonderful presentation. I had the pleasure of listening to you this morning in Wise Men. Likewise, it was most enjoyable and informative. My son is a primary doctor, and I'm sure he's going to appreciate what you're trying to do. That I'm happy for. What I'm not happy about is that there's evidently a cadre of people in this room who are not here to listen to you, but to embarrass you. And I think they fail. Thank you. Please carry on your good work.
Thank you. Thank you for those comments. Look, I try to be frank about what's good and bad in these things, and yeah, this has been a very, very aggressive debate. I usually welcome that. I almost always welcome that. Look, these are big issues. We should have a really intense argument about them. I think we probably boiled over a little bit in this debate in some ways that were unconstructive. But look, it's my job to hear all points of view, and I thank you so much for being here today to listen on this important topic.